Hello and welcome to Let's Prepare for Cancer Treatment. I'm Azmina, lead for Personalised Cancer Care, and together with my colleagues Gemma and Claire, I'm going to be taking you through today's session. Now, before we get started, a quick word of warning. The information that we're going to be giving you in this session is very general because it's aimed at people with all different types of cancers. So if your nurse or your doctor has told you something different, then we want you to listen to them and not us. That's because the information that your own doctor and your own cancer nurse will be giving you is personalised and individualised to you. By the end of today's session, we hope that you'll feel more confident about managing all aspects of your health and well-being throughout your upcoming cancer treatment. So, prepare. What's that all about? Well, P stands for Personalised Cancer Care. We'll be telling you what that is and, most importantly, how it can help you. R is for Reacting to Cancer. We'll be talking about some of the emotions that you may feel and also that your loved ones may feel. E is for Eating Well, because healthy eating during cancer treatment is really important. So we'll be giving you a few tips on how you can eat healthily and look after your diet and nutrition. P is for Physical Activity. Moving your body and staying physically active during cancer treatment is known to be very helpful. So we'll be talking a little bit about some of the ways that you can make sure that you stay active and stay physically fit. A is for After Effects and Side Effects of treatment. We'll only be talking about these a little bit because your own doctors and nurses will be going through these with you on an individual basis. R is for Resources. Resources to help you in the community outside the hospital. There are so many charities and different organisations out there just ready and waiting to help people with cancer. But until cancer comes your way, you just don't know about them. And why would you? And finally, E is for the extra help with the costs of cancer. We know that having cancer can bring some money worries. For example, you might be worrying about the cost of travelling to hospital very often, or you might be worried about money because you've had to cut back on work. We'll be talking to you a little bit about where you can get help with some of these financial worries. Personalised cancer care is the reason that I'm talking to you today. It means that we're here to help with some of the non-medical things, as well as giving you your anti-cancer treatment. Your anti-cancer treatment plan is there to deal with what's the matter with you. But Personalised Cancer Care is here to ask what matters to you. You may be asked if you want to complete something called a holistic needs assessment. Now that's a mouthful, but essentially it's a checklist which asks you to rank a whole range of emotional, practical, relationship and physical concerns on a scale of 0 to 10. And it helps us to understand what matters to you. If you are invited to complete a holistic needs assessment by one of the team, we really would encourage you to say yes. It's perfectly natural to have a whole range of different emotions and feelings after a cancer diagnosis. And there's no right or wrong way to feel. Everybody copes in their own individual way, and family and friends can have a range of feelings too. Some days you might feel up and upbeat, other days you might feel down. Some people describe it as like being on a roller coaster or being caught in a whirlwind. And certainly when you have a lot of hospital appointments in quick succession, it can feel as though you really don't have time to even catch your breath. Some feelings will come and go quite quickly, whereas others will linger. You may experience sudden changes in your thoughts and in your mood. That's not something to be concerned about. It's all part of the process of accepting your diagnosis and coming to terms with the fact that you are going to have some anti-cancer treatment. There is professional help available should you need it. We have psychologists and we have counsellors. But for most people, the passage of time really helps, and we come to a point where we can accept what's happening. Many people will feel numb when they hear the diagnosis, but for some people that numbness continues throughout treatment. When we're having treatment, it can feel like we're on autopilot because you have to turn up at this hospital on this day for this treatment and then turn up at another hospital on another day for something else. So for some people, it's actually only when treatment ends or nears the end that the feelings start to surface and the head and the heart start to catch up with everything that the body has been through. For some people who have had a long route to diagnosis, perhaps going to their GP several times with symptoms, they can actually be relieved to know that what they have is cancer. Having a diagnosis can help to bring clarity and also bring a plan for what lies ahead. We'd like to encourage you to be kind to yourself and accept a helping hand. Friends and family are probably really keen to help you, but they just don't know what they should do. So if you can designate some tasks and delegate them to friends or family members, that's a really positive thing to do. It's really important to connect with others. Lots of people will be asking how you are, but actually sometimes all of the well-meaning questions can get a bit much. If you find that actually it's tiring to respond to everybody's well-meaning inquiries, we recommend that you elect a spokesperson, somebody who can respond to messages and give updates on your behalf. You can have a WhatsApp group so that you're only typing a reply once, or you can do it by email, an email to all, perhaps once a week rather than regularly. It's important to do something that brings you pleasure every day. Life with cancer is still a life, and we can't put everything on hold until treatment is over. So if there is something you like doing, something that will bring a smile to your face, I would really encourage you to make sure that you allocate some time for that. Maintaining a healthy lifestyle throughout your cancer treatment is really important. So that means eating well, having a healthy diet, and also being physically active and moving our bodies. It's also important to get a good night's sleep and be well rested. We'll be talking a little bit more about this later on. You might want to think about something that's helped you through a difficult situation in the past. If there was a strategy that helped you to cope then, we'd encourage you to think back and try it again. Above all, we'd like to give you full permission to be a bit selfish and say no if something is too much. I often say that having cancer treatment is more like a marathon than a sprint. And if you do conserve some energy and some resources, it just means that you'll have that little bit extra to give at the time that you most need it. We'll be talking a little bit about managing energy levels later. Cancer really does affect the whole household, and it can be particularly difficult for family members to have to watch you go through treatment. It can be difficult not knowing what to say or what to do to help. You may find that your family don't want to talk to you directly about their own anxieties and worries. They think you've got enough to do getting on with treatment. And also, they want to be strong for you. There are places that friends and family members can go to get support, and we'll be telling you a little bit about those later on.
Having problems sleeping is very, very common with a cancer diagnosis. Lots of things are entering into your head and you're probably very worried about what's going to happen. But there are lots and lots of things that we can do to support and help you. Try to keep to regular hours and routine because that can really help your body to get into a pattern that is healthy. Try to wake up at the same time and go to bed at the same time each day. Our bodies prefer to be in a regular sleep pattern, and you will feel the benefits of that. Think about creating a restful, calm environment before you go to sleep. Make sure that there's minimal noise and that the temperature of the room is comfortable for you. Make it a nice, peaceful, dark environment because that can really help induce a good sleep. Having a really comfortable bed is equally important. Think about your bedding, your pillows and your mattress. Limiting caffeine is also important because caffeine's a stimulant and it can keep you awake at night. So try and limit your intake. Opt maybe for something herbal that doesn't have any caffeine in, and that can really help.
Exercise is actually something that's been known to help people get a good night's sleep. But the key thing with exercise is to do it at the right time of day. So we wouldn't encourage you to exercise right before bed because that's going to perk you up and make it harder for you to sleep. So try to exercise earlier in the day so that you get the benefits but can still sleep.
Mobile phones and laptops can really interfere with sleep. Try and keep away from using them when you go to bed. Smoking can really affect your sleep because it's a stimulant. It's important that you wind down before bed. Maybe take a hot bath, do a bit of yoga. Reading's good as well. Listening to a podcast. All of these things can really help.
And if your worries and concerns are keeping you awake, one of the things that I'd encourage you to do is to write them down. Getting them out of your head and onto a piece of paper can actually really help. You can then pick up the phone in the morning and speak to your nurse or your doctor. Fatigue is something that you may suffer from as a side effect of your cancer treatment or from the cancer itself. One of the things that can happen is that you can get trapped in the boom or bust cycle. What this means is that when you have a good day, when you feel full of beans and full of energy, you do too much and then you end up paying for it the next day when your energy levels go really low. We have to restrain ourselves from doing too much on any one day. In the long term, this can help to regulate our energy levels and help to manage fatigue. To avoid becoming trapped in the boom or bust cycle and to help regulate energy, you might want to consider the 4 Ps: prioritizing, planning, pacing, and permission. Prioritizing means that we assign different rankings of importance to our tasks. So what is the thing that we absolutely must do today? And what is the thing that could wait till tomorrow? Or maybe even next week. Planning ahead is so important because it helps encourage us not to overdo things. If you pre-plan and decide in advance what you're going to do on a particular day, you can actually help to regulate yourself and stop yourself from getting too carried away. Pacing is about being aware of what you're doing and when. One way that you can really help to pace yourself is to use something called an activity or pacing diary. This lays out all of the activities that you do, when you do them, and how long each one takes you. It helps to clearly see which activities you might be spending too much time on and which activities perhaps you could do more of. And finally, we have permission. Permission to stop and rest if you feel that you're doing too much without feeling at all guilty, and permission to ask other people to do something for you rather than pressurizing yourself to do it alone.
There are different aims to cancer treatments. We can aim to cure the cancer, which means to get rid of it entirely for you. We can aim to control it, to slow it down and improve your quality of life. Or we can aim to control your symptoms to make you feel better to go about your normal daily life. The type of treatment that you have will depend on the type of cancer you have and the stage of your cancer. Your consultant and your clinical nurse specialist will discuss this with you to explain to you what our aim for treatment is. Many people with the same type of cancer have different treatment options, so it's important that you don't compare your treatment to your friends or family or somebody you may know that's already been through treatment. Everybody's plan is individualised to them. Surgery means that there is a specific area that we can remove or that we think we can improve the quality of your life with a surgical intervention. Surgery is not always curative, but can extend your life or provide you with symptom relief. Surgery can be used at any point in your pathway, so it doesn't necessarily come first. Sometimes we'll give you some chemotherapy or radiotherapy before surgery, and sometimes we'll give you chemotherapy or radiotherapy after your surgery. And again, that really depends on the type of cancer you have and the stage of your cancer. Before surgery, you'll meet our pre-assessment team. Their job is to make sure that you're well enough to undergo surgery, to check your lungs and your heart, to make sure that you are fit to undergo the surgery and will recover well after. People's main concern after surgery is whether or not they'll be in pain. You should never be in pain. You've had an operation. I expect you to be uncomfortable. I expect you to be a little bit sore, especially when moving, but you should never be in pain. And if you are, you need to let us know because there'll be lots that we can offer you. It's important for your recovery that you are comfortable because we want you to be up and moving around after your surgery. One of the side effects you can experience after surgery is nausea, the feeling that you're going to be sick. It's very rare to actually vomit, but often people have this nausea which is associated with the anaesthetic and some of the pain medications that we'll give you. A lot of this will go after the first 48 hours, but if it does linger, we can give you medicine to help control this. It's important to control your nausea because we want you to be up and moving around and eating as quickly as possible after your surgery. After your surgery, you might find that you become slightly constipated, and again, this can be linked to either the anaesthetic or the painkillers that we're giving you. Constipation can mean either not going to the toilet or passing a harder stool when you do, which is uncomfortable. If you are constipated, speak to a member of staff and they'll be able to give you some laxatives to help gently move your bowels. Having a cancer puts you at higher risk of a blood clot. Having surgery also puts you at a slightly higher risk of a blood clot. Therefore, we're really keen to ensure that we reduce this risk for you. When you come into hospital, you'll be asked to put on a pair of stockings, which are very tight socks that go from your toe to your knees and help improve the blood flow, reducing the risk of a blood clot. You'll also be given an injection into your tummy that helps thin your blood. This is only if you aren't on regular blood thinners. Some of the signs and symptoms we want you to monitor for a blood clot, particularly after you go home, are redness and swelling in one or both of your calves, or pain in one or both your calves. We also want you to watch for shortness of breath or a tightness in your chest. If you do experience any of these symptoms, we would ask you to either call 999 or attend A&E immediately. When you go into theatre, you'll have a needle put into your arm to help give you the medicine to put you to sleep. When you wake up, you might have a number of other needles, drains, or catheters. The needles are to ensure that we can give you fluids and give you drugs and to keep you comfortable and hydrated while you're asleep. A catheter is to ensure that you're able to pass urine, and it allows us to monitor your urine output. After major surgery, we'll leave the catheter in between 24 to 48 hours. You may also have a drain in situ. A drain is a small tube going into the area of the operation that allows any excess blood or fluid that may be left from the operation to drain away. This will normally stay in between 24 to 48 hours and we will remove it once it stops draining.
I would add that waking up with drips and drains isn't just scary for you as the patient. It can also be a bit of a shock for family members that come to visit too. Sometimes seeing you there with the drips and the drains can be the first moment that it really hits them that you're not well. And this is also something to bear in mind if children are coming to visit you on the ward.
After your surgery, you won't be as mobile as normal, and this can result in not being able to expand your lungs as you normally would. When we breathe in deeply standing up, the bottom of our lungs expand to ensure that no fluid collects. When you're sitting down or lying down, it's more difficult for your lungs to fully expand. It's really important after your surgery that we get you up and moving as quickly as we can, and we'll support this with physiotherapists coming to assist you. It's also really important that you do some deep breathing to really expand the base of your lungs, even when you're lying in bed. Everything we've talked about so far are short-term effects. What I want to talk to you about now is the longer-term effects. Some of these can last weeks or months, but some of them can last a lifetime. Key ones that we want you to watch out for are lymphedema, which is a swelling of the arms or legs, a swelling of the limbs that doesn't go down. This can be caused when we take away some of the glands around the area of your cancer. We can treat this with compression bandaging, and specialist clinics exist to help support you with this. Following any surgery, you might struggle with body image. That means that when you look in the mirror, you might feel differently. You might struggle with what you see. All surgeries will leave a type of scar, whether that be small or large, and that's something that's different and a visual reminder for you. Following some surgeries, though, you might have even more visible reminders of your cancer. For some ladies, you might have a mastectomy. Some bowel patients might have a stoma, for example. Some of our prostate patients might have a long-term catheter. These are all visible reminders and can be really difficult for you to manage. If you are struggling, it's important that you reach out to us and get help, whether that be via your cancer nurse specialist or speaking to a psychologist, but also there are support groups available. Following your surgery, you may struggle with continence. This can be related to having a catheter in for a number of days, which can affect the muscles that control our ability to pass urine, or it can be from the surgery if you've had pelvic surgery or urology surgery. Often this improves within a couple of weeks, but it's really important both before and after surgery to use pelvic floor muscle exercises to help improve the strength and the tone of that area, and this will improve your continence following surgery. Sexual dysfunction can be a risk after some operations in the pelvic area. We have many clinics offering support after if you are struggling with your sexual function. It's important that you don't feel embarrassed and that you engage with us so that we can help support you with this. A common question is, when can you become sexually active again after surgery? Intimacy is an important part of our lives, and we would encourage you to speak to your consultant or your clinical nurse specialist so that you know when it is safe for you to start having sexual intercourse again. With all of these, it's really important that we get an early intervention. So if you do struggle with any longer term effects, please do let your clinical nurse specialist know or your consultant know so that we can help support you early. This will improve the outcome for you.
Chemotherapy is a systemic treatment. It can be used when we can't cut cancer out, or before or after surgery. If you're having chemotherapy before, it's used to control or shrink the cancer. If you're having chemotherapy after, it's used as insurance and reduces the risk of it returning and mops up any cells which are too small to be visible. Sometimes chemotherapy may be the only treatment, and other times it will be given in combination with another treatment type, for example radiotherapy or immunotherapy. It can be in pill form, taken orally, or it can go into the blood system, taken intravenously. Side effects for each of these can be varied. If you're going to have chemotherapy or immunotherapy, you will have a special appointment beforehand where it will be explained to you and you'll have a chance to ask questions. Everyone will be on different regimes or combinations of chemotherapy agents or drugs. You may hear the doctors and nurses talk about cycles. This just means the length of time between doses. So it could be weekly, every 2 weeks, or every 3 weeks. One block of these weeks is called a cycle. In between each cycle, you'll have a blood test and have an appointment with an oncology doctor, cancer nurse, or cancer pharmacist. When you have chemotherapy or immunotherapy, you will be given a 24-hour helpline number. This is called AOS, or the Acute Oncology Service. It will be explained to you when you should call this number. You may also be given a cancer treatment record book. This is a good place to make notes about how you felt after each cycle of chemotherapy or immunotherapy, so that you don't forget to tell the doctor or nurse when they ask. Radiotherapy targets a specific area or multiple defined sites. Radiotherapy is measured in fractions, so whereas with chemotherapy you'll hear about cycles, with radiotherapy you may hear about fractions. Before starting radiotherapy, you will have a separate CT planning scan for us to plan where the beams are going to go. The more accurate we are, the less side effects you will deal with. Unless you're having a single dose of radiotherapy, it will usually be a daily treatment, Monday to Friday, and is typically given over a number of weeks, but this can vary.
One of the side effects that we as your clinical team worry most about is high temperature or fever.
Ideally, we'd like you to have a thermometer at home so that you can track your temperature. But the signs to watch out for are feeling very hot, feeling very cold, feeling so cold that your body starts shaking severely.
You will be told by the team when to call the emergency helpline if you do have a high temperature or fever, and you must please follow their advice. Another side effect that we do tend to worry about is diarrhea, which can happen if you have chemotherapy or immunotherapy, but also if you have radiotherapy to the pelvic area.
Diarrhea means going to the toilet 4 times more than you normally would, or having very loose or explosive stool. If you develop this symptom at home, you need to contact the AOS support line immediately.
Other possible treatment side effects include nausea or vomiting, fatigue or tiredness, hair loss or thinning, changes to your taste or appetite, hot flushes, mood swings, neuropathy, which is reduced sensation, skin irritation and mouth soreness, blood conditions such as anemia and neutropenia, as well as effects on sexual function and fertility.
There are so many different side effects, and I know it can feel a little overwhelming. But most people will have very few, if any, of these side effects. We just need to tell you about them so that you're aware in case.
It's important when you come in to see us or when you have your consultations that you let us know what's happening with you. And there is a huge amount we can do to help support you and help manage your side effects.
Please do be completely open and honest with us about how you're feeling and any changes that you may have noticed in your body.
Some patients find it helpful to keep a record book or a diary, bearing in mind you might not see us for 2 or 3 weeks.
That way, when you do speak to the nurse or doctor, you can refer back to your notes or to your record-keeping app, and then you can explain quite accurately how you felt. We have some tips and tricks that can help you with your side effects. If you do have nausea because of your chemotherapy, we might recommend something like ginger tea or ginger biscuits, even ginger cake. Ginger doesn't help everybody with nausea, but it's worth giving it a try. If you have a metallic taste in your mouth, which can happen with certain chemotherapy medications, try a slice of fresh pineapple on your tongue, and it helps to refresh your mouth and demetallicize the taste buds. If you do end up with a stomach upset, we have a tip for you. You're entitled to have a radar key, which is a key that opens disabled toilets. Cancer is qualified as a disability under the Equality Act, and that means that you are entitled to use disabled toilets should you need to. Similarly, we would encourage you to get the Macmillan Toilet Card. This is a card that gives you access to toilets in an emergency situation, so when you need to go to the toilet urgently. The toilets that it can help you get access to are the ones that would normally be off limits to members of the public. For example, the staff toilets in a shop or toilets in a restaurant that you're not eating at. If the tiredness does set in, you might find it helpful to have a "Please offer me a seat" badge for when you're travelling on public transport. This is just something that you wear that encourages other commuters or travellers to offer you their seat so that you can just have a sit down, which is less tiring. There are a few NHS-approved apps that we'd like to tell you about, and these can be helpful if you do have any side effects that are bothering you. So we have Sleepio to help you get a good night's sleep at night. We have Daylight, which helps a lot with anxiety. And we have Untire, which can help with cancer-related fatigue.
Eating is so important for maintaining a healthy weight and nutritional status during cancer treatment because all our cells need to be able to repair themselves following the effects of chemotherapy and radiotherapy. But there are many reasons why our appetite may be affected. Anxiety may be one of them. You may be unable to eat or do the opposite and eat too much, like comfort eating. Where the cancer is can affect your ability to eat, for example, if it's in your stomach, mouth or bowel. Treatment itself and side effects can make your taste buds change, or nausea can make you be put off food. If nausea is stopping you from eating well, you may be prescribed some anti-sickness medication. If you're struggling with eating little and often can really help. Try grazing and snacking throughout the day rather than eating 3 larger meals. And you can swap to a smaller size plate if your usual portion size now feels overwhelming, or try fruit and veg smoothies if you can't face big portions of fruit and veg. If you're struggling to maintain your weight and have lost weight, you can eat higher fat foods. These may be the foods you think of as being unhealthy, but there are situations where there are benefits of eating them, and you might want to add extra butter to toast, or add cream to soups, or swap to full-fat milk in your cereal and coffee. Eat the rainbow. By eating as many different coloured fruit and veg as possible, you'll get more of the different vitamins and minerals you need. There are specialist cancer dietitians in hospitals, and you can be referred to them for a review and advice if need be. Dietitians may recommend supplements if you've lost weight. There are liquid nutritional drinks. These nutritional supplements should be taken as well as food if possible, not instead of. A lot of patients ask about drinking alcohol. On balance, it is safe to indulge within the government recommended limits, but you probably won't tolerate it as well. You may want to have a spritzer instead of wine, or half instead of a pint. We do advise not to drink the day before chemotherapy, on the day of chemotherapy, or the day after chemotherapy, because alcohol is dehydrating and it's better to be well hydrated for treatment. Balance is the key, so try to be sensible, everything in moderation.
It's important to remember that these eating tips are very general. If your doctor or nurse has told you something else, perhaps they've told you that you need to restrict a certain type of food because of your medical condition, then please follow their advice and not ours. Equally, if you have another medical condition, for example diabetes, you may have been told to avoid certain foods, not by your cancer doctor or nurse, but by your diabetes doctor or nurse. Again, please follow their advice over ours, because what we're saying is general and applies to a majority of patients, but not all.
Navigating information about food and cancer can feel overwhelming, especially with so much in the news and online. It's natural to focus on what you eat, as it feels like something you can control. There are many common ideas about food and cancer, from supplements and organic produce to myths about things like sugar or dairy. While some dietary adjustments can be beneficial, it's vital to remember that not all information out there is scientifically proven. For example, you might hear claims of the benefits of superfoods or highly restrictive diets, but the evidence often doesn't support these claims. Before making any significant changes to your diet or trying herbal products or vitamins, always speak to your doctor or a qualified healthcare professional. This is crucial to ensure any new approach is safe for you and won't negatively interact with your treatment or existing health conditions. Your healthcare team can provide personalised, evidence-based advice tailored to your specific needs. Remember, when it comes to your health, reliable advice is key.
There is lots of evidence supporting the benefits of exercise for our health whilst having cancer treatment, for reducing the risk of recurrence and improving outcomes for cancer patients. Moving our bodies is good for our cardiovascular system, our heart and lungs. Activity also helps combat fatigue. Even a gentle walk outdoors can wake our bodies up and energise us. Movement makes us feel good and lifts our mood. If you do need to manage your weight, being active is half of the equation, combined with nutrition and diet as the other half. Being physically active helps our muscle strength and our joints, helping us to stay flexible. And it can also give us more self-confidence, especially if we're trying a new type of activity or are aiming to beat or meet a particular target. such as counting the number of steps we take each day. Picking an activity that you enjoy will mean you're likely to keep it up. Being active should feel good and not like a chore. Although we do encourage keeping active during cancer treatment, it's also important to listen to your body and look out for signs that you may be overdoing it. If you are worried about doing too much, one of the things you might find helpful is a structured programme such as Move For You. This is currently available across North Central London and involves guided exercise sessions with an accredited trainer. Ask your nurse, doctor or GP if you'd like to know more. Preparing the body before surgery or treatment will enhance your recovery and how you tolerate treatment. Whilst on chemotherapy and radiotherapy, it's perfectly safe to maintain activity levels, but do listen to your body. If, for example, you're a regular gym user or a runner, you may need to reduce the intensity. If you're not usually active, simple jobs around the house are also significant. So, for example, gardening, housework, going up and down the stairs, carrying shopping home from the shops, or even dancing around your kitchen table. Find something you enjoy doing. Group exercise can be more motivating than on your own. For those with other health conditions or limited mobility, there are gentle seated exercises that you can do while sitting in a chair. The NHS website has videos you can follow from the comfort of your own home. Don't throw yourself into something new like running a long distance if you've never tried that before. It will feel terrible and you'll hate it. Start small and gradually build up length of time or distance. Balance activity with rest so you don't overdo it, particularly when you're on treatment.
If you are currently a smoker, we would strongly encourage you to please stop. Stopping smoking is one of the best things that you can do for your overall general health. Smoking can actually delay wound healing after an operation and put you at greater risk of infection. And there is so much help available to support you to stop. Ask any doctor or nurse, either at the hospital or in your GP practice. Or if you wanted to, you could go to any pharmacy on the high street and ask them for help to stop smoking.
If you or someone you know is affected by cancer, it's important to know there is a wide network of support available in the North Central London area. You can find a Macmillan Cancer Information and Support Centre in all of our hospitals. They offer a confidential listening ear and expert information. And support doesn't stop at the hospital doors. There are many places in the community that you can go to for help and support. A good place to find out what's available near your home or near your workplace, if that's more convenient, is the Cancer Care Map. Or you can ask at the hospital or your GP practice. Many of these groups and cancer support centres offer support to family members as well as people with cancer. And they also offer opportunities to meet with others who are going through something similar, and therefore really and truly understand.
At the moment, having cancer might already feel like a full-time job, and so you might think that you really don't have time to go to any of these cancer support centres or engage in any of these activities. That's absolutely fine. Do just remember that there is lots of help and support out there. And perhaps down the line, you might want to circle back to it.
We'd like to add a word of caution about seeking information online. Not all sources of online information are accurate, and you can actually worry yourself even more by reading some material. The websites that are trustworthy, accurate and reliable are the NHS website and the charities Macmillan Cancer Support and Cancer Research UK. All of the main different types of cancer also have charities for that specific cancer type. These charities are also sources of up-to-date accurate information, and they also have helplines or online chat functions where you can access expert advice. You and your family may be worried about the financial impact of having cancer and the extra costs that are coming your way. This could be extra travel costs because of frequent hospital appointments. It could be mounting bills if you had to stop work or reduce work. Or it could be that having cancer is making you think about planning for the future and your financial or housing situation. The Macmillan Cancer Information and Support Services inside hospitals and the community-based cancer support centres will be able to offer you information about these issues and connect you to a welfare benefits advice service. As well as taking you through what benefits you might be entitled to, they can tell you about help with travel costs, such as the healthcare travel costs schemes, and other concessions, for example for parking if you need to travel to hospital by car. Cancer patients are currently entitled to free prescriptions, and in terms of work and workplaces are covered by the Equality Act 2010. The Equality Act protects people from discrimination on the basis of a characteristic, such as a disability or health condition like cancer.
Finally, we'd like to thank you for joining us for this Let's Prepare for Cancer treatment session. We hope that you found it useful, and we'd like to wish you all the very best for your upcoming treatment.